The heated debate over Bernie Sanders' Medicare for All plan has engendered a curious phenomenon. A number of liberal economists and public intellectuals, many of whom are longtime single-payer supporters and experts, have done a sudden about-face on the issue, discovering new concerns with single-payer healthcare. Vox editor Ezra Klein and New York Times columnist Paul Krugman both declared that Bernie Sanders' single-payer plan was, quote, puppies and rainbows. Economist Austin Goolsbee doubled down and called the plan magic flying puppies with winning lotto tickets tied to their collars. Does Bernie Sanders' single-payer plan really belong in a fantasy novel? To find out, we consulted the nation's leading expert on puppies and rainbows, economist Gerald Friedman at the University of Massachusetts. We're here at his house in Amherst, Massachusetts to discuss Sanders' controversial plan. Mainstream commentators have written off the Sanders single-payer plan as unrealistic. Is it crazy to think that a single-payer system could provide comprehensive health care to every resident in the United States at no additional cost?
Far from crazy. It's crazy to think we can do anything else. If we want to provide universal coverage for everybody, under the current system, well, we could do it, but it is very expensive already and becoming more and more expensive. And this is something that is almost unique to the United States. The cost of healthcare is rising in the United States, has more than doubled in the United States over the last 40 years, solely because of increases in prices. We're paying more and more and more for the same thing. That's not happening in other countries with single-payer programs. It's not happening in Canada. In Canada, they're spending somewhat more on healthcare than they used to because they're getting more services. The price of healthcare has not changed in Canada compared to 40 years relative to the price of other things.
Paul Starr has argued that the level of centralization of healthcare called for by Sanders' plan is unlike what is done in other countries. Is the Sanders single-payer proposal substantially different from the systems we see in other countries?
What Senator Sanders is proposing is basically what's done everywhere else. It's not substantially different because the basic processing of bills and payments would be the same. You go to a doctor, as is done now in Canada, you swipe your card, and they type in your diagnostic code and your treatment code, and that's it. A few weeks later, the doctor gets a check. Done. What's different about the Sanders plan is it covers more. It would cover everything without co-pays and deductibles, everything except over-the-counter drugs and a small number of voluntary procedures, cosmetic surgeries without medical justification.
Paul Krugman and Ezra Klein both write that single-payer systems save money by saying no to patients, refusing to provide some treatments or drugs, and that Americans are not used to this form of regulation. Krugman claims that single-payer is more like, quote, Medicaid than Medicare for all. Is this true?
Oh, no, that's another ridiculous argument. Rationing happens under the current system. Rationing happens because 10% of the population doesn't have health insurance and just gets whatever they can get. And another 10 to 15% of the population has seriously inadequate health insurance or seriously underinsured and cannot afford to go to a doctor when they're sick. 20% of the population did not fill a prescription in the past year because they couldn't afford the cost. Those people are being rationed. Under a Medicare for All system, we would save so much money by reducing administrative waste and by controlling the excessive prices of certain pharmaceuticals that we would be able to provide real care for everybody. And how would this care be provided? Where would the resources come from? They'd come from the financial resources would come from the savings, but there'd also be the resources freed up when doctors aren't spending so much time on the telephone dealing with insurance companies. There'd be resources provided when doctors are able to reallocate nurses and hospitals are able to reallocate nurses currently spending all day dealing with insurance companies. Nurses will be able to provide health care to patients. So there'll be more resources available and less rationing than under the current system.